Everybody, welcome back to another live session. Today we're going to focus on doing some stretch and mobility movements that can help alleviate some lower back pain. May help. I want to stress that. Like I said, if you're having chronic lower back pain, stretching might not be the only thing that can alleviate that. I think it can be helpful, but you might also need to work on strengthening and or obviously see an orthopedic doctor to see if there's any structural issues. But if you have general lower back tightness, whether it be from sitting all day or possibly doing some sort of athletic endeavor, maybe golf or a lot of volleyball players around here, even sand volleyballers, adults and youth. This is kind of this today's session is going to kind of showcase some movements that you can do to kind of help alleviate lower back pain or tightness. All right, so we're on the ground. We're going to start with one of my faves, and surprisingly, a lot of guys' favorites. I don't know why. I've run into a couple of my clients that like this movement. It's called the frog stretch. Okay, so I'm going to show you from a couple angles. First one will be our side view. Okay, my knees are spread out. My instep of my foot is down, trying to get down flat on the ground. I'm looking at my elbows. I'm just rocking, pushing my butt back as far as it'll go. I'm just going to do 10-second holds. You can kind of see I have a neutral spine. Try not to do too much arching or rounding. Kind of neutral and hold that position. I feel inside my adductors, inside my thighs, or the groin area, as some people refer to. I'll just rock forward a little bit, take a little tension off. And I'll rock back. So we're really, what you can see, or what you'll probably see, throughout this session, whether you're watching it live or watching it after fact, is really stretching and mobilizing muscle groups and joints that kind of surround and connect to the pelvis. Right? So obviously hip, lower back, upper back, T-spine. We're going to work a little bit of that too. Hamstring, quad, knee joint. So really kind of either stretching the muscles or mobilizing those joints. That's kind of what we focus on to alleviate back pain. Right? And it can't, in theory, say it could be a nerve, nerve, when we talk about sciatica, or people talk about sciatica pain, which is, a nervous system, can be caused by a nerve, the sciatic nerve, which is also, it could be, a structural issue too, if you have some sort of, possibly vertebrae issue that's pushing on that nerve. A lot of these stretching and mobility movements are prescribed for individuals with sciatica pain, including this frog. So I'm going to show you from the side view, or from the front view, so you can kind of see the legs. I don't want to give you the back view. That's, trying to be a little simple. So, knees spread out, and you guys can kind of see my toes are pushed out to the side. Really feel a good deep stretch inside here. And believe it or not, like I mentioned, I have, it's probably because I probably have, I don't know, I've never done the count. I think I have more male clients than female clients, but I have several male clients that this is one of their favorite stretches. And I think it probably has to do with the fact that, the male's pelvis is constructed differently than female pelvis. So I think a lot of tightness, for lack of better words, males have, typically can have more tightness in that area, Alright, so now we're going to go from that to cats and cows. Now this one I like to do, but I know some people, especially if you have chronic lower back pain, this might not be for you. But I would say if you just have lower back tightness, I think this is a good movement. We're going to really flex and extend the lower back on this one, right? So cat, I'm going to arch my back around. So this is a anterior tilt. Alright, extending the lower back. Really trying to work my whole spine, not just the lower back. Alright, and then I want to round it towards the ceiling. And this is the posterior tilt of the pelvis. So as I say, I don't really just feel my lower back. I am trying to flex my lower back, flex my spine, really. And then I'm going to extend. Alright, I try not to just focus on the lower back. So if I just focused on the lower back, it would look like that. And that's good too. I mean, obviously you're getting movement through that lower back, so there's no problem with that. I try to work my whole entire spine to the top of my neck. I have a lot of, as I mentioned, neck and upper back pain, where a lot of my tightness and pain is. So I really want to like this move too. And you can even, there's a lot of people I've seen, they really try to focus on moving each individual vertebrae one at a time until you get to the top. Kind of a physical cue, and then I'll reverse it. See if I can reverse it. One vertebrae at a time. I lost my train of thought. That was so good, I lost my train of thought. What was I talking about? Well, I'll go from the top. Go to the next question. Oh, so one of the kind of verbal cues I give individuals when doing movement like this, or when we do our standing kind of hip rotations and pelvic tilts, especially for our golfers. Bringing my belly button towards my chin. And then pulling my belly button away from the chin. Alright. Now, going to the beloved hip car. Okay? I know we probably do this in every single live workout, whether it be we're doing weightlifting or if we're doing golf mobility or doing stick mobility, right? It might be just stick mobility, I'm charging the hip car now. So, side lane hip car. When it comes to one hip mobility movement, I would say this is the go-to, in my opinion. You know? I think taking your hip joint through its, 6 degrees of movement, flexion, extension, abduction, rotation, internal, external rotation. I think moving that, doing this one move, really can set you up for success. Alleviate pain, help athletic performance, increase longevity. I mean, they talk about the longevity studies I've seen and heard about is just all about the importance of balance, hip mobility, flexibility, because, individuals, especially elderly individuals, falling and breaking a bone is very, it increases the mortality rate by a significant amount. And I'm not saying that a hip collar is going to prevent you from breaking a bone, but it probably will increase your chances of, if you're stepping on an uneven surface, or you step off or something like that, step off the curb, having more mobility in your joints, is going to help you increase your chances of minimizing things like a fall, right? Obviously, strength is also going to help. Balance, coordination is also going to help. But joint mobility is also a part of that. You can't, if you're immobile and you walk only like in one kind of path, you're not able to rotate your hip or flex your leg up high enough, to put your foot up on a curb, it's going to increase your chances of being hurt, So it's mobility and flexibility is a big part of that too. Not just about being strong, which is important, not saying it's not, but they are complementary. So as we see what we're doing here, right? We're going to knee to elbow, flexion, abduction, internal rotation, and then I kick the foot back. This is extension, external rotation, adduction. Alright? Feels so good. Feels so good. Hurts so good. No. Does not hurt. Alright. This is the last one. And I'm going to go to the one I would think a very large percentage of people know. A little combo. Actually, I'm going to do a little trio. I'm going to do up dog, down dog, child pose. Okay? If you've done yoga, this is probably go-to, and they have, and I will admit, different yoga practitioners have different names and different moves. So I call this up dog, down dog, dog pose. So if you're a yoga practitioner and you say that's not right, okay. So we got the up dog here. Now there's a couple different schools of thought. Some people can press up hard on the thigh, on the palms, get the top of their feet, expose the chin to the sky. I like that. I get a little bit more restful. My legs are resting on the ground here. I tuck my toes, tailbone to the ceiling. When I'm here, my kind of verbal cue is to push my chest to the top of my thighs. I let my knees bend, kind of get a good calf stretch too, so I'm trying to drive those heels down to the floor. There's probably certain people that can do this straight leg, but when I go straight leg, my background's a little bit more. So I like to go a little bit more flat back here, okay? And I'm going to break it down to the child pose, okay? Child pose. When I get in my child pose, I don't rest my head on the ground. Alright? I actually push palms hard into the floor, keep my head off the ground. Almost like if I'm pushing my butt back, push my hands into the ground, and then my palms on the floor, and then push my butt back to my feet. When pushing my palms to the floor really radiates that lat muscle. So that's why I learned this move, this combo, really. When people ask, I'll show it from the front side. When people ask for some go-to flexibility and mobility moves at home, I got a little kind of video I send them. It starts with this trio right here. Up dog, down dog, child pose, right? Well, sorry. Let's go up dog. I said it and then I went to down dog. Ugh. Yep. Like I said, I am capable of doing these moves, but if you have lower back issues, some of these can be beneficial. Some of them, depending on the severity of the lower back issues, may not be for you, or at least at this time. All right? So you may have something you have to kind of work on, whether it be an injury or kind of a weakness. I don't think you have to be able to do this alleviate back technique. Do a couple of show you several different moves that I think at least there's going to be something you can pull from this live workout that you'll be able to accomplish for sure. All right, let's go to this next one. This one is probably one that essentially everybody can accomplish in some variation. Is the glute stretch, or big four, as I like to call it. Okay. Right ankle is going to be on my left knee, okay? I'm going to grab my left leg, pull it towards me. So I'm bringing this shin towards my chest. I have that flexibility, thankfully, to kind of grab the front of my shin, right? And I'm just resting my head on the ground and actively pulling the leg in, all right? When I actively pull, I can feel this muscle right here start to get stretched. And when this leg is just like this, in this position, I'm actually externally rotating my hip bone, my thigh bone. So I'm just going to hang out maybe about 10 seconds. Then we're going to do internal hip rotation on this side, right? So now, put my left foot down, let my legs fall to the right side. My right foot is actively pushing my left knee towards the ground. And I'll feel the stretch over here on the left side. Okay, probably in the left hip, sometimes into that left lower back too. I'm actively trying to push that knee down with that top foot. Okay? Tightening my shoulder blades on the ground, sometimes even looking away from the knees is a great way to kind of even more, or to kind of intensify that stretch. Alright, let's go back to this. Alright. Do a little ankle cross while you're here if you want to. And that's the thing, I mean, I know I kind of outlined several of the movements and the joints and muscle groups that can kind of be responsible for causing lower back tightness or pain. But again, it could be It could be anything. Honestly, I mean, you could compensate due to upper body injury. You know, like a hand injury, you could be compensating by just using one arm opposed to, trying to basically be ambidextrous. And, you're carrying weight all on one side, then all of a sudden you're left, the other side of the lower back hurts. It's not necessarily just the muscles that surround this area. I'm going to switch. I'm going to change, get a little angle so you guys can see. Actually, I'll go this way. All right? So you guys can see from a little different angle. Right. Oh, this one's a little tighter on this side. So my glute for sure, left glute, and then my external hip rotation on this left side. It was definitely lacking. More so than the right side. So yeah, that's the thing is, I know, saying, obviously outlining the muscles and joints that kind of make up the lower back area, or surround the lower back, making those flexible and mobile is important and can help, but it's not necessarily the end all be all for the cause of lower back pain. All right, so it's definitely that's why taking a comprehensive approach to flexibility and mobility is definitely probably the best route. Yeah, I can feel it here. Now, and that's kind of where we kind of separate between injury and just, a flexibility and mobility issue opposed to an injury issue. Now, injury issue, just stretching it nonstop is not necessarily the best way to recover from an injury, say, to your lower back, whether it be structural or muscular. That's why physical therapists, that's where going to an orthopedic doctor and/or physical therapist is kind of the best option if you have an ongoing injury. But with that said, I mean, we've had plenty of people that have got their kind of diagnosis from the physical therapist and brought it in here, and they found out it's nothing structural, that it's more, to get time to recover from an injury, and there's no structural issues, and then they have to strengthen mobility, flexibility, strengthening. To kind of, that's how really it's another approach, or kind of approach we take, especially in here, for kind of, alleviating lower back pain. If we rule out the chronic issue or the structural, and even if people choose not to have surgery, which is definitely, a personal choice, there's things we can do to stretch and strengthen to kind of alleviate pain. All right, so that was the figure 4. Another one of my go-to ones. All right, so now we're going to do adductor stretch. So similar to the frog, but definitely a little different kind of input. Right, we're going to do a rocker. So I'm rocking back and forth. Got that foot nice and flat. Push the pressure down into the floor so I can feel it radiate all the way. The frog stretch was really a lot more inside here. This one I have to really travel down towards the inside of my knee. Rocking back and forth, switch sides. Oh yeah, this feels good. Yes, I needed this one today. Very appropriate. I will say sometimes I look through the live workouts and make sure I try not to, I make sure to try to have a little variety week to week. Then we're doing the same thing over and over. I haven't done a lower back one, or kind of a stretching mobility that focuses on lower back issues in a while, but I can definitely use this one today. All right, so from the adductor, we're going to do a re-strength. All right, so obviously I'm mobilizing, moving my upper back, but I'm really kind of stretching that sling fascia that surrounds the body. A little rotation of the lumbar back on this. So that connective tissue, that kind of covers the muscles, the fascia, this run in spiral lines and different types of pathways around your body. So different stretching mobility movements actually do stretch that. So those can, much like a muscle, can get very tight. And keeping those loose is very important, especially that's kind of what, you always see athletes warming up. That's an important way to get them ready for, their sport or their activity is through warm-up movements that mobilize and stretch out the fascia you talk about like gaining flexibility of a certain muscle, you know, you gotta, the kind of the active stretching we're doing here wouldn't necessarily gain a ton of mobility, or not, sorry, flexibility in a muscle group, right? Really long, sustained holds is really what you need to kind of do in order to increase flexibility in a certain muscle group. So that is, so it's once again another aspect of the static holds. You know, 1 minute, 2 minutes, that can really help improve flexibility. But is it the best thing to do before working out or, you know, going on a round of golf? Typically what we find, the answer is no. It's usually better for like post. Pre, we like to do our warm-up movements, get the body temperature up, get muscles literally warmed up, kind of mobilize the joints, turn on that neuromuscular system. So that's what a lot of stuff you'll see here too. And you know, there's definitely benefits from sitting and doing a hamstring stretch up the wall for 1 minute 60, but probably don't want to hit that right before you go do a workout or go out for any athletic endeavor. All right, world's greatest stretch. I'm going to do this one to finish this out today. Now, there is some debate. Some people say it's the world's greatest stretch. Other people don't. You be the judge. All right, so here we go. Push-up position, mountain climber. Okay, so I got my foot outside my hand. Same arm, sort of reach, thread through, kind of like I did on the adductor, and drive up to the sky. I'm stretching here. Got some hamstring. I got some quad, hip flexor, lower back, upper back. Man, it's hitting a lot of stuff. I don't know. Let's get a vote. If you're watching this, lay in the comments, is the world's greatest stretch actually the world's greatest stretch? All right, let me show you from a different angle. There you go. All right. Oh, yeah. If you have an issue staying in this push position, maybe you have some wrist issues, you can always bring this back and down too if you'd like. Good. All right, that's it for today. Hopefully you enjoyed that. That was just a preview of Pride, you know. 7 or 8 different movements that can be used to kind of alleviate lower back pain. As I mentioned in the beginning, tightness, pain is one thing. If you obviously have an injury, you need to get diagnosed by a professional. But stretching and mobility is something you can do both, you know, if you have tightness, but even if you are coming back from an injury, focusing on stretching and mobility I think is always beneficial. You know, obviously you may have to not do certain movements depending on your injury or severity of your lower back issues, but there are some. It's definitely going to be something that you're going to want to be doing long term. So hopefully you guys like this live workout. Please leave a comment, maybe on our YouTube page or on our feed. We're going to have that up there for the next week. We got to maybe give us some insight onto the next live workout you'd like to check out. And like I said, if you didn't follow along today, go ahead, go to our YouTube channel. All the live workouts, past live workouts are up there. So I will see you next week.